Hello everyone, I'm Dr. Vivek Venkat, consultant Uro-Oncologist and Robotic Surgeon in Mumbai. A question I often get from many patients is how their workplace and occupational exposures may affect their urologic health or risk for urologic cancers. It is quite obvious that there are certain risk factors related to our workplace that may increase the risk of developing certain diseases. This is true for both benign diseases as well as a few urologic cancers. The first and most important is dehydration. We are often sitting in an air conditioned environment during our work hours, and that's why we tend not to drink adequate amounts of water and can easily get dehydrated. Especially in a humid environment like Mumbai, if we go out and sweat a lot and then don't replace those fluids, this also adds to our risk for dehydration. One common reason patients tell me they don't drink enough water during their workplace is the lack of access to a clean or a toilets, just a simple thing like that. And therefore, they don't want to go during their office hours and they wait till they reach home. I think this is a very valid point. People often don't want to use public bathrooms. It's both a hygiene issue as well as an access issue, and therefore they avoid drinking adequate amounts of water. But as a company or as an office, I think it's important you talk to your superiors or your supervisors that that is really the bare minimum that can be provided in the workplace, and that is important both for physical as well as mental health of any person in a workplace. So, dehydration can raise the risk of urinary system stones, which may occur in the kidney, the bladder, or the ureters. This is especially true for those who already have a genetic tendency to produce more calcium in their urine and therefore are more prone to form stones. These patients, especially, need to be very conscious and even set reminders that they should be drinking water regularly throughout their working day and generally aim at about 2.5 to 3 liters of fluids in a day. A simple way of remembering whether you are adequately hydrated is that the urine color should be as clear as the water you are drinking. Long hours at a desk is also a very sedentary form of life, and this may promote obesity, which is associated, as we know, with a whole host of diseases across all organs in the body. In urology, obesity is important because it is more prone to cause diabetes, which can lead to an increased incidence of urinary infections as well as urinary stones. Obesity is also a risk factor for both kidney and prostate cancer, and in fact, it is associated with slightly more aggressive varieties of prostate cancer. Therefore, it is important to keep moving, take some breaks during your long work day, and walk for a bit or do some exercises, stretch at your desk side so that you remain active through the day, and as well as dedicate some part of the day either before or after work to some form of exercise. Exercise by itself, whether or not you lose weight, helps to prevent cancer. So it is the simplest, cheapest, most cost effective drug that we can say is protective or preventive against cancers and of course a huge other number of diseases as well. Urinary bladder cancer is sometimes considered an occupational disease. This is because certain chemicals, especially commonly used in the dye, paint, textile, rubber, or petroleum industries, mainly amine group of compounds, if absorbed into the body, they increase the risk of developing urinary bladder cancer. This is why, if you are in such industries, please use adequate protective equipment in the form of gloves or suits or whatever may be needed in order to minimize your direct contact with these harmful chemicals and reduce your risk of developing urinary bladder cancer. Certain metals like nickel and cadmium have also been implicated in kidney cancer, and therefore those who work in battery industries may be exposed to these kind of heavy metals, and they should also use adequate protective equipment. So we've seen that the workplace is an important potential contributory factor to both developing benign as well as rarely some kind of malignancies of the urinary system. It is important that you keep these in mind, maintain adequate hydration, do good exercise, take little breaks in between your long desk jobs. So, as we have seen, there are a number of contributory factors in a person's workplace which may potentially increase their risk of developing certain urologic diseases. Therefore, it's important to take care of your urologic health at work as well. If you found this video informative, please like and share it with others, and don't forget to subscribe to my YouTube channel. Thank you.